We're talking with Dr. Maria Carrillo, Chief Science Officer of the Alzheimer's Association. Dr. Carrillo, by the numbers, can you give us a snapshot of the state of Alzheimer's?
Alzheimer's disease, unfortunately, is on the rise in the United States. But currently, there are 5.4 million Americans living with this disease. And we estimate that about 200,000 of those are actually younger onset, so in their 50s and maybe early 60s. So a disease that certainly affects all of us in this country, but we're not alone. It is a global crisis, and many other countries are also on the rise, many of whom are lower and middle income countries that are going to exponentially increase in numbers faster, actually, than the United States and, for example, Europe would be.
You say women are at the epicenter of this epidemic. Why is that?
Women are disproportionately affected by Alzheimer's disease in several ways, and I'll just name a couple. First, 60% of caregivers for people with Alzheimer's or a related dementia are women, and so that causes all kinds of, not only stress, but lack of taking care of their own health. Perhaps it also leads to poverty more in women than men because they have to leave their jobs or take part-time jobs, cut back on work, etc. But the other way in which they are affected that I will mention that's important is that 2/3 of Americans living with Alzheimer's disease are women, and so we don't quite understand yet if that's just because we're living a little bit longer than men, because that's still the case. We do still outlive them by about 3 years on the national scale, or is there something else, some biological or genetic reason? So that's going to be a very interesting question that we're very interested in asking.
We learned today that federal funding is largely flat for the last 5 years for Alzheimer's. How is the Alzheimer's Association raising money for research, and what are the new goals for your research?
So, unfortunately, we have had a period of some time in our country where we've been living in an economic austerity. And that is changing, and we're all very happy to see that. But unfortunately, funding for the National Institutes of Health broadly has suffered as a result, but more specifically Alzheimer's disease, because it wasn't funded to the level originally where it should have been 10 years ago, and at only about $450 million a year in comparison to, the 5 and 6 billion that cancer or HIV or heart disease receive really is a paltry sum. But very recently, the Alzheimer's Association, through our advocacy efforts and our sister organization, our C4 AIM, the Alzheimer's Impact Movement, we have seen that there are changes. And we're really pleased to see that Congress is making Alzheimer's disease a priority in this decade. And we have doubled the spending for Alzheimer's disease at the National Institutes of Health, specifically within the National Institute on Aging, to about $991 million to date. That's great to see. We know that we need at least $2 billion from a panel of experts that we convened years ago that made that recommendation. And we hope that with the announcement very recently and out of the Senate Appropriations Committee for another $400 million for Alzheimer's, that we might actually get to almost $1.4 billion. So that's changing. And our organization, of course, is also increasing its funding for Alzheimer's disease research. We are contributors because we don't just fund within the United States, we fund all around the world. And that's important too, because the cure can come from anywhere, and we want it to happen faster.
And you spoke of innovation and changing the types of research that you're funding. Can you explain that?
Sure. So the Alzheimer's Association has been thinking of ways that we're going to change our contribution to the scientific community globally because there's more money at the federal level. And that's great news for all of us, and we hope to see that even continue more so. But how can we as an organization really continue to affect that change and provide seed money for future directions in Alzheimer's research? We know that there's a lot more work that needs to be done in other dementias and that contribute to Alzheimer's disease. We know that early career investigators have really been starved of funding in Alzheimer's, and they've gone perhaps to other diseases. We want them to come back, and we want junior investigators just thinking about their future career path. We want them to those bright minds to come to Alzheimer's disease and help us with our challenges. So that's one way in which we're going to really focus our funding. But another is to really look for those innovative ideas and new approaches. One of them, for example, is a different approach that we've just issued this year called the Part the Cloud Inflammation Challenge. And an inflammation challenge is that we know inflammation is a very important part of really our health, right? And in the brain, it is no different. And we've talked about inflammation with traumatic brain injury, with other diseases, including Alzheimer's. And so we've issued a challenge, and that's very unique. We're giving $1 million awards to 4 investigators around the world. Some of them are in biotechs, some of them are in academia. And we're going to actually give them a prize at the end of their 2-year grant, because if they make their metrics and meet their marks, we're going to give them $3 million to actually take that project to the next level. It's called the Inflammation Challenge. And if you make your marks, we're going to give you $3 million to continue your work in inflammation, in neurodegenerative disease. So that's very different. It's not something that happens at the federal government level right now, and it's actually a global challenge. So we're trying to look for those innovative ideas and actually how to really create opportunities for scientists to want to come to study a particular area of science that we think is underfunded and should be focused on more.
Final question. What is the IDEA study and what is the goal?
The IDEAS study, IDEAS stands for Imaging Dementia, Evidence for Amyloid Scanning. So that study is really a study that was based out of the knowledge that amyloid imaging was going to be available because it was approved by the FDA. And what it does is it allows us to take a picture of the brain and see amyloid, where amyloid is. So it does not provide a direct diagnosis of Alzheimer's because amyloid can be in the brain for many reasons, including just normal aging, but it is one of the hallmarks of Alzheimer's and may be able to help us make a better diagnosis of Alzheimer's in those people that perhaps have an uncertain presentation, an abnormal way of displaying their memory changes, with psychotic episodes, maybe hallucinations, other things. So we felt that it was very important for this to be available to the community as an organization. And so the Alzheimer's Association recommended the Centers of Medicare and Medicaid to provide coverage and reimbursement in very specific situations. Unfortunately, CMS didn't believe that in a sense, and so they issued a non-coverage decision nationally, but they agreed to cover amyloid imaging under a certain rubric called coverage with evidence development. And so the IDEA study is a reaction to coverage with evidence development. It provides the ability for almost 19,000 individuals around the United States that are Medicare beneficiaries to have an amyloid scan if they meet certain criteria of an uncertain diagnosis or mild cognitive impairment, and of course have to be Medicare beneficiaries for this to be covered. And we'll gather the evidence that we need to demonstrate to Medicare and Medicaid that this tool and technology, though expensive, should be covered, especially in certain instances in which it can clarify a diagnosis for a family.
Thank you very much.
Thank you.